Hello guys. Today we're talking all about knee pain myths. Now, I've talked a lot about knee pain for hiking on this podcast, purely for the fact that it's such an important subject in the hiking community because so many people suffer from knee pain on the trail and so many people are so confused and just don't understand about what they can be doing to help prevent this. And I've talked through a whole bunch of different subjects on this in the past, and today I'm going to be talking about a few particular myths which I see time and time again come up on social media. And it's been instigated by a recent post I saw in a Facebook group which I'm a part of, in which someone was complaining about knee pain. They got a whole bunch of different suggestions, and a lot of it was a little bit worrying. And a lot of this stuff I've sort of built out into other things that I hear pretty regularly. So we're just going to be breaking down these myths, just explaining a little bit about it. So hopefully by the end, if you do see these things come up, or if you do believe these things at the moment, then maybe you might have a bit of a different insight into some potential other explanations around it. So knee pain myth number one is if you have knee pain, you cannot do squats. Now I see this all the time and people throw it around that squats are bad for your knees. And basically when it comes down to it, squats are no more harmful for your knees than any other exercise. They can be a really fantastic exercise for building up strength in the quadriceps and the glutes to help develop extra knee stability, I should say, not knee pain. And they can be a really great part of your rehab journey. It's just when people don't apply it very well and don't perform it very well, that's when it leads into pain. There's a couple of really common errors when it comes to squats, which ends up people taking a lot of pressure in their knees. As opposed to putting into the other muscles. So if you're not 100% aware of how to do your squat and how to apply that, then go see a coach down your gym. Every single coach should be able to teach you how to do a squat and get a little bit of direction around that. On top of that, if you are dealing with knee pain, straight away going into super heavy squats with a barbell on your back probably isn't the best idea in the world. You know, the great thing around this, or the best thing you should follow around this, is master your body weight before adding load, and when you add load, slowly progress it. So for my knee pain clients, when they're getting into squats, even if they've told me they've been squatting for many times, I'll make sure they start off with body weight squats with a band around their knees, maybe even starting from a chair, just to make sure they get the movement right, their body's used to it and they're applying it right. Then I'll slowly add load. So we'll probably put a dumbbell which they hold at their front, which is called a goblet squat, which is very safe and it doesn't really have any issues. And then slowly but surely we'll progress that. Eventually we might use a barbell on their back, but we apply that at the correct time. So if you've heard the thing before that you can't do squats because you have knee pain, just try not to think in those absolutes. You can do squats, you just need to apply them and do them right. So that's knee pain myth number one, and something I see all the time. Number two, knee pain myth number two is you are fragile. Now, this comes down to a whole bunch of things, but basically, most people are a lot more resilient than they think. And I see when people come to me with knee pain issues and they've said, look, I've had knee pain for years and years. I got these exercises from some other type of professional, and I've been doing them for ages and they haven't done any good. And you look at the exercises and sometimes it's just really conservative. And the strength training is really trying to treat them like a newborn baby almost. And the exercises just don't have any load on them. They don't have any progression. And it ends up with them just doing things like, a clamshell or a leg extension for 12 weeks. And that's it. And like, every single exercise has their place in a program and every single exercise is beneficial in certain situations. But if you're not progressively challenging your body, if you're not progressively adding a reasonable amount of load, and if you're not progressively giving yourself extra stimulus, you're not going to improve. So if someone's treating you like a newborn baby and they really just not been allowing you to progress and get stronger and adapt, you might want to look elsewhere. Now, I'm not talking about someone who's just had surgery here. Obviously, that whole journey is very different. But if someone who just has general knee pain on the trail and you're stuck doing the same thing for weeks on end, and you never give any strain, you never gain any strength, and you just feel like you're going nowhere, you might want to get a second opinion because you are a lot more resilient than you think. The next knee pain myth number three is that you constantly need manual therapy. Now, manual therapy is basically any type of hands-on therapy applied to your muscles. So this can be like massage, this can be soft tissue work, this can be acupuncture, this can be ultrasound, this can be, really crazy mobilizations. It can be literally anything. That all goes under the manual therapy umbrella. And there's a lot of debate in the physio world about whether this is worthwhile or not, whether it's sort of even worth doing at all. And I'm not really going to dive into that because there's a massive debate around that, and I'm not interested in going down that subject. In all honesty, there can be no argument it can help with short-term pain relief. That's for a number of theorized reasons, and a lot of people will say that you can be doing other things, cheaper things, easier things for the same results. But again, we're not going to be diving down that. But what I want to make the point of, if you're stuck in constant manual therapy, meaning you've been seeing a chiropractor or an acupuncturist once a week for 3 months and it's not getting better, it's not the route for you. It can give short-term pain relief. It can calm the body down, relieve pain. It'll help it move better in the short term, but it's not a solution for the majority of people. Usually you need to be doing some other thing to help the body get stronger, to help the body stabilize, or whatever around that type of stuff. And if someone's stuck you in this cycle of constantly needing to go see them, it's really, really not a good thing. Now, physios, massage therapists, chiropractors, whatever, if they're treating a particular issue, in all honesty, they should have an exit plan for you, meaning they should be saying, look, over this time period, we're going to be aiming to achieve X, Y, and Z. By the time Z is achieved, then you can go off and do your own, and you can come back to see me if you have issues. Instead, if they're like, look, we're just going to work on your legs for an hour, you feel good for a few days, you start feeling sore again, you go back and see them, and they make you feel good again. That's a terrible trap to be caught in, and it's really not something you should be doing. So if someone's trying to push manual therapy on you as a long-term thing, it's really, really not a good course of action, and I'm very, very strong believer of that. So have a think about that. Now, knee pain myth number 4 is that inflammation is the biggest enemy number 1. Meaning, if people tell you you have to immediately cut out things like sugar, dairy, alcohol, or whatever, that's a bit of an issue. Now, inflammation is a massive buzzword in the health community at the moment. Most people, in all honesty, don't understand it. They just say it, and they say sugar causes inflammation, or dairy causes inflammation, or alcohol causes inflammation. And that's the reason why you're constantly in pain. It's such a massive topic and no one understands it. And I will say I don't properly understand it either. I've never dove down that rabbit hole, but I know enough to tell you it's a massive buzzword, and it doesn't have to be the number 1 thing you're aiming for. There are people out there who genuinely have chronic inflammation going on, and there's specific medical or the specific allergic or specific whatever reasons going on that's causing inflammation chronically, which is causing them issues. But the majority of people out there, chronic inflammation or inflammation as a whole isn't going to be the be all and end all. And when people say you have to cut out sugar, you have to cut out dairy, you have to cut out alcohol specifically to help your knee pain, that's a worry. Usually when people get results from this type of thing, they might have gone down their own journey and they've cut out sugar or dairy or alcohol and they've started feeling really good. Sometimes, or usually, it's not really what the people have stopped actually doing unless they have a particular specific medical issue or allergic issue or anything like that. What they've done is they've taken those foods, which might not be so good in their day-to-day life. They might be just eating lots of cheese, lots of chocolate, lots of booze or whatever, and they've replaced those foods with whole food sources, meaning a bit more natural foods, and not that they have particular low sugar or low dairy or anything like that, but these other foods have a lot better micronutrient profile, meaning they're just giving your body more nutrients, and your body might be lacking something, and that's what's made the difference, and help it calm down, help it feel better, and help all that. So it might not be so much the sugar was causing you issue, it's like now you're taking in something you were missing, and that's helping you. That's a really important point to make, and that's where so much confusion and misquotation comes out on the internet, because people are like, look, I dropped sugar, I feel amazing, but it might just be what you've actually changed. Now, this usually goes hand in hand on top of that. It's not only just the food, the more, in quotation marks, healthy food you're taking in, but it might be you just become more health conscious as well in that thing. It usually goes hand in hand. So you might be doing more exercise. You might be losing weight in other ways. You might be less stressed. You might be looking after your sleep. All of these factors can play into pain 100%. So sometimes this whole holistic approach just gets summed down into one particular thing that's demonized, and that becomes an issue. Because if you cut out sugar and it doesn't work for you, you're like, oh, nothing works for me. And that is a big myth. So Again, something I'm pretty passionate about, something that I could probably talk about for ages, and I barely scraped the surface there, but hopefully you get the idea there. If someone's just telling you to cut something out of your diet, or telling you that number one, the cause is inflammation, and you don't understand the actual root cause of it, or anything like that, you're probably barking up the wrong tree. And then the final pillar, which sort of bounces off that, is a final myth, I should say, which bounces off this, is supplements are your first priority. Time and time and time again, I see people on the internet, they're like, I have knee pain or I have back pain or whatever. And someone's like, buy these 3 supplements, buy fish oil, buy glucosamine, buy turmeric, or whatever. All of these anti-inflammatory, and this will help you. And, there is a reasonable amount of evidence to show that particular supplements can help in certain situations. But when it comes to any type of supplement thing, this is like percentages, 1% at a time, changing your overall outlook. So you're forking out all these monies for these tiny, tiny changes. And yes, they might be effective if you're doing everything else. But if you're looking at supplements as your first priority to help get on top of pain, it's outrageous. And you just really, really need to have a step back and really, really think, am I ticking off all my other things? So have you seen a professional and gotten something diagnosed? Are you working with specific strength work to help stabilize your knee? Are you doing particular mobility work if there's restriction? Are you managing your training load? Are you doing too much? Are you balancing things out throughout the week? Are you doing other exercise which isn't just walking? Are you constantly stressed? Are you sleeping well? All of these things should be covered before you get into supplements. And that's something, again, I'm very, very firmly a big believer in. So there are our knee pain myths for today. There's no exercise like squats that you cannot do. You just need to apply it right. You are a lot more resilient than you might think, so please don't get treated like a newborn baby. The constant cycle of manual therapy is not a good thing to be stuck in. Don't demonize things like sugar, dairy, alcohol, or look down inflammation as the cause of your knee pain. And don't use supplements as your first priority. Work on the basics, stay consistent with it for month after month. Find a professional you can trust, who can guide you through the process, who can help you through the ups and downs, and that's going to be much more effective for your knee pain than following up on any of those myths. So, got a little bit ranty there today. I apologize about that, but I do hope you've gotten a bit of value out of this and it has cleared up a few particular subjects. If anything wasn't so clear today, or you want expanding on this, or you might completely disagree with something I've said, please do feel free to swing me an email. I'm always happy to chat about this stuff. And as always, it's not me talking gospel, it is a discussion around this, and there's so many factors which play into so many things. So please do reach out to me if you've got anything to say on this subject. As always, if you have enjoyed this episode, please, I would absolutely love if you could leave a review for this podcast on whatever podcast platform you're listening. It really would mean the world to me. So have a lovely day, have a think about all that, and we'll talk to you very, very soon.